available to members who are unable to attend, or as a refresher for program directors after they start the survey. Second, please mute your phones in order to cut down on background noise. Lastly, please hold all questions until the end of the webinar. If you have a question while the webinar is in progress, please type your question into the comment box and we will respond to your question after the webinar is presented, when we open up the floor for questions. Don't worry if you do not have any questions today, as Rachel and I will be available to answer any questions in the weeks to come. First, I'd like to tell you a little bit about the survey. Mandatory timely completion of the survey is required of all PAEA members. According to the PAEA Policies and Procedures Manual, PAEA surveys all member programs annually to gather data of interest to PA programs, sponsoring institutions, policymakers, and other stakeholders. This is published in the Annual Report on Physician Assistant Educational Programs in the United States. Achieving a 100% response rate on the annual program survey, as is the norm for most other health education professions, will enhance the value of the data. According to the policy, member programs must agree to provide, and member programs must provide, annual data for the Annual Report on Physician Assistant Educational Programs upon PAEA request. Programs are given ample time to complete the survey. However, it is possible to lose membership if a program does not complete the survey. PAEA and the research department staff understand the demands on time of program directors and other faculty members, and truly appreciate the work they do to provide data to PAEA. Our research endeavors are made possible by you, your students, and your faculty. The survey is sent to program directors of all PAEA member programs. Because the survey is sent via email, it is important to keep your program and faculty information up to date in the PAEA membership database so that we send the survey to the correct email address. PAEA Research Department staff will review all surveys and follow up with program directors if data are missing or needed to be confirmed. An example of this would be if we saw a short program length that may have been reported in months rather than weeks. Quality data are important, and following up right away helps the PAEA Research Department stay on track with data analysis and publishing the next report. There are also many chances to win when you complete the survey. Programs that complete the survey on time are entered into a drawing for free registration to the 2014 Annual Education Forum or a gift card for the program. Next, I'd like to give you more information about the unique link that you will use to access the survey. Each program director will receive a unique link to use in order to access the survey. Survey links are included in the invitation email, which includes instructions, deadline information, and an attachment of the survey instrument. The link can be used on multiple devices and by multiple faculty or staff members. Program directors may wish to delegate the task of filling out the survey or parts of the survey to other faculty or staff. Program directors will only need to send the link to these faculty or staff members. Once the survey is submitted, it cannot be accessed again. So if the survey is accidentally submitted and needs to be reopened, please contact the PAEA Research Department and they can open it for you. Staff will only send links to program directors or faculty and staff members that include the written permission of the program director to obtain the link. This is to ensure the protection of your program's data. Next, I have a few best practices for you to keep in mind when completing the survey. The first best practice is to review the survey instrument attached to the invitation email before beginning the survey. A copy of the survey instrument is attached to the invitation email so that you may review it and determine what data are needed before beginning. The second best practice is to review your program's responses to the previous year's survey. Programs were given the option of downloading their responses to the 2013 program survey. If you require a copy of your survey responses, please email your request to research@paeaonline.org. Because these reports may include sensitive information, such as salary data, reports will only be sent to program directors or to faculty and staff members that have written permission from their program director. The third best practice is to use either Google Chrome or Firefox as your web browsers. We recognize that many programs only have access to Internet Explorer, but if possible, please use Google Chrome or Firefox. Some features, such as the table of contents drop-down menu that will be mentioned later in this webinar, may not be available to Internet Explorer users. The survey is much more streamlined this year, so no major issues are anticipated for Internet Explorer users. The fourth best practice is to pay attention to error messages. Many of the limitations, minimum and maximum values, for example, were removed from the survey. However, some restrictions apply, such as decimals and numeric entry required, and survey takers will not be able to move forward until the issue is resolved. Please pay close attention to the error messages, as they will tell the survey taker what questions there are issues with and why. The fifth and final best practice is that deadlines are extremely important. Programs are given plenty of time and lots of tools to ensure timely completion of the survey. It is important to collect all data on time so that it may be analyzed and reported to membership. Before reviewing some key features, I'd like to go over some important pieces of information about the survey invitation. The survey invitation email was sent to all PAEA member program directors on June 16th. If you did not receive an email, please check your spam and junk folders. Emails should be addressed from research@paeaonline.org. If there has been a recent change in program directors, please contact PAEA immediately so that the survey can be sent to the appropriate faculty or staff member or interim program director. Also, we know that your program has other events and business to take care of, such as site visits and graduation. So please be sure to take note of the survey due date so as to plan its completion around other program business. This will ensure submitting data by the due date. The survey invitation includes the survey link, instructions for completing the survey, the deadline, survey instrument, and the PAEA Research Department contact information. Next, I'd like to show you some screenshots of key features in the survey. We will be highlighting each of these key features as we navigate through the survey during this webinar. The table of contents provides easy navigation throughout the survey and enables you to skip around the survey. The table of contents can be accessed for Google Chrome or Firefox users by using the drop-down menu in the upper left-hand corner of the screen, or by using the Table of Contents button at the bottom right-hand corner of the screen. Internet Explorer users are usually only able to use the lower button. Downloading responses is another key feature that I wanted to review. Qualtrics has improved the ease of downloading your program's responses after submitting the survey. As the survey is much shorter, all programs should be able to download and save their responses. These reports are also more printer-friendly this year. If you missed the opportunity to download your responses, please contact research@paeaonline.org, and PAEA will gladly send you a copy. Lastly, I'd like to highlight some exciting new features. PAEA relied on your input and response to past surveys and removed the employee profile section of the program survey. The data are now collected through the PA Program Faculty and Directors Survey, which launched in April 2014. This makes the program survey much shorter, easier to navigate, and faster to complete. By going to faculty and directors through the faculty survey, PAEA collects more reliable data. Thank you for filling out the survey. The program survey will still collect information about faculty, staff, and director FTE. Hover over definitions are a helpful new feature that we've included in this year's survey. Look for terms and phrases in blue text throughout the survey. When you find them, move your cursor over the word to display a pop-up text box that includes a definition. These definitions can also be found on the survey instrument attached to the invitation email. Next, Rachel will go through the survey platform in real time, highlighting new or key questions. Following the tour of the survey, we will open up the floor for questions.
Hello, everyone, and thanks for joining. I'll be taking you through the survey on the Qualtrics platform with the goal of familiarizing you all with the tool and hopefully addressing any questions you may have. For the sake of time, I'm not going to go through the entire instrument, but I do want to touch upon some new questions and specific questions that may have been confusing in the past or may have been changed slightly. First up is General Information section. So I can navigate to it here. There we go. All right, well, here's the introduction, and we'll go to the general information section now. There we go. All right, this section collects information about your institution and program, such as administrative housing, program length, credentials awarded, etc. This year, there were a few new questions added to the section on the subjects of satellite campuses, academic credits, and some more information about pre-PA programs, but this section does remain relatively straightforward. And as you can see on the page, there are some examples of the hover over definitions, so don't forget to utilize those. If you just lay your cursor on top of the term in blue, a pop-up text box will come up. If you click, as I'm doing now, nothing happens. You have to wait over there. So I'm going to touch upon two questions quickly. The first one is question 4, which collects information on the person filling out the survey. And this is really important to include all this information so that PIEA research department staff can contact the correct person with any questions we have regarding the data. Research staff will review surveys as they're submitted and will follow up right away if we have any questions. And this is just to ensure timely release of data and reports. Secondly is question 10. If you'll give me a moment here to navigate through. This is question 10, which should be familiar to you all and collects total program length. But just a note, this is an example of why it's really important to read the instructions of the survey as we collect program length in weeks and not months, which is a common mistake that programs make. So just a heads up to make sure to read all of the questions thoroughly. Next, we'll navigate to the financial section of the survey. Remember that you can use this table of contents feature up here if you are using Google Chrome like I am, or if you're using Firefox. I do recommend that Internet Explorer users use this table of contents button here. And that will take you to the screen that you first saw when I showed you all the survey. But I'm going to go ahead and use the drop-down menu here. And this section collects program-level financial information, such as budget, expenses, payment to clinical sites, scholarships awarded, as well as student-level financial information, which includes tuition, fees, incidental costs, and out-of-pocket expenses. Just a reminder to please only enter numeric characters in the fields in this section. Symbols such as commas, dollar signs, or percentage signs will result in an error message. Most questions no longer have a maximum value that can be entered due to some of the complications they caused programs last year. But if you do encounter any problems or receive error messages that you're unsure of, please shoot an email to research@piaeaonline.org. Look up my information on the PIEA website and give me a call. We'll be happy to help you sort that out right away. And I just want to touch on two questions in this section. And here they are. Questions 24 and 25, which both collect information on program expenses. The first question asks for total program expenses, while the subsequent question asks for only certain categories for program expenses, such as faculty and staff salaries. So the amounts that you enter in all of these categories may not equal the total that you indicated above in question 24, but that's okay. We're only interested in the specific categories outlined in 25. This seemed to be cause a bit of questions, or caused a lot of questions last year, so just wanted to highlight that for you all. Next up is the program personnel section, which covers program FTE, new hires and any barriers to hiring, and faculty workload. And I just want to touch upon two new questions here, but notice that I'm getting an error message because of question 33, which is telling me that I need my total down here to equal 100. If this arises and you're not completely sure of the data, you can go ahead and estimate and always use the table of contents feature at a later time once you have that data to make sure that it's accurate before you submit. Also in this section, just please make sure you pay attention to questions and whether they ask for FTE versus a head count, as we do ask for data on both. And two new questions we've added that you can see on the screen, questions 37 and 38, and these are regarding faculty workload. PAEA wants to learn more about faculty workload at your program, so please do your best to estimate the number of credit hours for each category in 37 for a typical faculty member at your program. If this model is problematic to apply to your program, you can use the comment box at the end of the survey, which I'll touch upon in a few moments here, to provide feedback and notify PAEA of any other methods that you have to determine faculty workload. Your comments and feedback are integral to helping us develop future surveys and tweak surveys so that we get the best data possible. The fourth section is enrolled students, and I believe this was formerly called matriculants. But as you'll remember, it collects information about students throughout all years, as well as information such as GPAs, test scores, age, and healthcare experience hours for the matriculating class. There are just a couple questions I would like to touch upon. And that's question 41 here. Is your program currently provisionally accredited? And then the subsequent question, 41. And this is helping us to determine which programs have students and those do not, given the fact that we're continuously adding programs to membership. So if you were to select that your first-year class is not yet enrolled, that not only aids us with our pipeline information and advocacy, but also we know to not send the matriculating student survey to you that year, as you wouldn't have any students. So moving on to 43 and 44. These two questions ask for the number of enrolled students based on gender and ethnicity, as well as gender and race, you can see in 44. And the granularity of these questions enables us to examine disparities across all of PA education, not individually at your program. This will help us aid our pipeline research and advocacy efforts. Also, just a note, the quality of the data that you provide translates into more granular and higher quality reporting. You'll also see two questions like this in the 2014 cohort section of the survey, which is a nice transition there. This section was formerly known as the graduate student section, but we've renamed it to the 2014 cohort section. The PAEA Research Department is making a move to collect data on a cohort system in order to yield more accurate data and counting of students. This removes the ambiguity of what year in which we include third-year students, if that's applicable for your program, and will also be able, and it will allow us to be able to better project future numbers of graduating students than in past years, which again aids our pipeline projections and advocacy efforts. This section includes cohort student status, enrolled versus withdrawn versus decelerated, as well as demographic information and information about any withdrawals from the program. Lastly, our three unique sections to this year's survey. Don't panic, we didn't just merely replace the employee profile with a bunch of new questions. These are relatively short. This is section 6 in its entirety, just one question. The Healthy People 2020 section was added to the 2014 program survey because PAEA is assisting the U.S. Department of Health and Human Services collect data for Healthy People 2020. This is an initiative aimed at improving the health of the nation. The data collected through this question will provide benchmarking data and understanding on the healthcare professions curriculum. I'll move on to section 7 here, which is the clinical training site section. This section is also a new addition to this year's survey and is based off of questions that were asked on the 2013 clerkship survey. This was a collaborative survey administered by the Association of American Medical Colleges in collaboration with PAEA, the American Association of Colleges of Osteopathic Medicine, and the American Association of Colleges of Nursing. In alliance with PAEA's strategic plan to develop a broad range of innovative clinical training opportunities for students, we must continue to gather data regarding programs' experiences with clinical training sites and preceptors. And also, a joint report has just been published a couple weeks ago by the for collaborating organizations and can now be found on PIEA's website. So be sure to check it out. It's a very informative report. Lastly is the STAR section. This year, the PIEA Research Council sponsored a new program called the Support to Advance Research Program. This invited faculty members to submit proposals to include their own survey questions on various areas of interest of theirs in the annual program survey. This year, the questions added to the survey are on the subject of motivational interviewing. Please support the principal investigator in providing as much data as you can. And now we can submit. Before completing and submitting the survey, feel free to leave any comments, questions, concerns about your experience with the survey. This could include citing questions that were confusing or problematic, questions or topics that you'd like to see in future surveys, or any other feedback you'd like to share. We really appreciate your time and feedback, and helps us improve our survey instruments from year to year and improve our data collection. So now we can go ahead and submit, and this year it's much easier to submit the survey. If you were the program director or the person filling out the survey last year, you'll remember it was a bit of a headache. Hitting the submit button here would take you back to the table of contents. And thankfully we've gotten rid of that little hiccup this year, and I can just go ahead and submit. And I am then now directed to this page, which would show data if I actually filled out the survey in live time. But this is the report that Lindsay was speaking to a few minutes ago. And you'll notice there's an Adobe Acrobat icon right up here in the top right-hand corner of your screen. If you just click that, you can export it, name it how you wish, and download it. If you miss the opportunity to do this, or if your computer is acting up as technology tends to do, please feel free to reach out to the PIEA Research Department staff, and we'll be happy to send a copy your way. Also, if you accidentally submit the survey and realize you didn't include some data or need to change some data, feel free to contact us and we'll send you a new link. This link will have all of your previous data still saved, so don't panic. You're not going to have to resubmit everything. Everything will be saved. You'll just be able to change or add what you'd like to do. But just a note, if this does happen, if you accidentally submit the survey, or if you do need a copy of your report, please note that staff will only send them to program directors or to staff members or other faculty members that have the written permission from the program director, or if the program director were to give us a call. And this is just to ensure the protection of your data. So with that, we will go ahead and open up the floor for any questions that you may have. We'll just wait a couple beats here, and feel free to use that chat feature. And I'll wait and see if there's anything you can think of. If not, feel free to reach out to staff as you think of questions, or as you're going through the survey and encounter questions. Well, it doesn't look like we have any at the moment. Again, feel free to reach out to us whenever. Lindsay and I are happy to help. And then just a couple of housekeeping items before I wrap up. Just a reminder to keep your membership database information up to date. That just helps us ensure that we're sending the survey to the correct person. If you do have any questions regarding that, about how to change information or update information, please contact Ashley Smith, and her email address is asmith@piaeaonline.org, and she'll be happy to help you. Also, make sure that you check out the 28th Annual Report, which is on the Physician Assistant Education Association's website. And we are currently working on the 29th Annual Report and hope to publish that in early 2015. So with that, we'll just say thank you for participating in this inaugural webinar. We hope that it has been helpful to you, and thank you for taking the time to provide the association with high-quality data.